Okay. Welcome everyone to Brain Northwest online programming. We are fortunate today to have Larissa um, Del Piero with us. She is a doctor of she's a clinical psychologist. She has a business owner, Pacific Brain Health and Wellness, and she also is on our board. So it's really a privilege to have a person with extensive background working with people that have experienced brain injury. In her private practice with the VA, and just has a long history of working in this community, from a place of a lot of research and personal research as well. So I'm really grateful that I get to learn along with all of you, and I'm so happy you're here, Larissa. So I'm going to mute myself and invite you to begin.
Thank you so much, Reggie. It's really wonderful to be here doing this class. I'm a relatively new board member to Brain Northwest, only the past couple months, and I am delighted to have gotten involved with this organization. It's just such a special, warm, and wonderful place, and so I'm really excited to find more and more ways to support this community. So I'm going to be talking today about long-term brain health, how to keep your brain healthy as you age, which is probably one of my favorite topics to talk about. I like to geek out on brain health and ways to exercise your brain, keep it active. Um, as Reggie said, I currently run a private practice. We're based in West Seattle. I'm a clinical psychologist with a specialty in neuropsychology. So I'll talk a little bit for just a minute here, if I can get my slides to advance. Come on. It was going, so we know it works. There we go. My background, as Reggie kind of mentioned, is I came up through my training at UW. Before that, I was down in the LA area. I am a USC alum for graduate school, and then came up to train in the Department of Rehabilitation Medicine at UW here. I stayed on in the Seattle area for a fellowship at the Seattle VA in the rehab medicine department there, primarily specializing in brain injury, and then stayed on a couple staff positions there. My last 2 years at the VA, I was the regional director for the Polytrauma TBI program, which is their program for Iraq and Afghanistan veterans coming back, primarily with symptoms related to traumatic brain injury, but also chronic pain and PTSD. So I was in more of an operational role there, and then realized that what I really wanted to do was to be working outside of a big hospital system, doing my own clinical work. And so I've built up my private practice, Pacific Brain Health and Wellness, where we offer a variety of services. Some of the things that we offer are neuropsychological assessments. Some of you may be familiar with that, and I'll kind of talk a bit more about what that entails. But it's primarily that we do a comprehensive interview gathering information about how somebody is doing in all aspects of their life, their thinking skills like memory and attention, but also, their social world and their sleep and their medical history. And we put all of that information together with some objective testing. So we do standardized testing of things like memory, attention, language functions, visual processing. We learn about a pattern of someone's strengths and weaknesses, and then we use that information to, in a really nuanced and informed way, help people figure out how to move forward, how to make their life better, how to really apply those tailored recommendations. We work with people with brain injuries, but we also do things more broadly in my clinic. So things like dementia evaluations, ADHD, autism, learning disability evaluations, and we have some supportive counseling services too. So we have somebody who does skills coaching around executive functioning, so planning, organizing, switching. And then we have somebody who specializes in working with people with different complex medical conditions that can include chronic pain, brain injury, strokes, using things like evidence-based treatments, including cognitive behavioral therapy and mindfulness, to really improve their well-being. So those are the things that we do. And highlighting here that some of the things that I'm going to really focus on today are memory and attention. Our brain does lots and lots of things, but I'm going to kind of dial in a little bit here on memory and attention, because I think those are kind of two of the most important cornerstones of our thinking skills, and also something that people often are asking us about. And I will say, I have a plan of where I'm going with this talk, but if you have a question and you want to jump in, I am not a formal stuffy presenter. You can jump in as long as that's okay with Reggie and I'm not breaking the rules. Um, and Reggie, I'm not the best at monitoring the chat as I'm talking. Would you just ping me if somebody is asking something? Or people can feel free to unmute. I would be okay with that as well.
I will monitor that. I forgot to
Thank you.
mention that. Yes, I am in charge of that.
Thank you. Okay. So what does our brain do? Our brain does lots of things. I love this diagram because I think it helps simplify, and this is kind of how I was taught as a neuropsychologist to think about what the brain does. So working from the bottom of this diagram up, we get lots of input information from our senses. First, it has to be processed. So we have to like actually understand the information, make sense of it, and we have to really importantly pay attention to it. It then goes into some deeper processes like processing language, processing the visual aspects of it, but also into our memory. And then further downstream, we have what we call executive functioning skills, so higher level thinking skills like planning, organizing. They're called executive functioning because it's like the things that an executive of a company would do, delegating, deciding what's important. And then at the top, we respond, we have some output. And when we are having difficulties thinking more generally, something is usually breaking down somewhere in this process. And it can be hard just from either your own experience or looking at somebody on the outside to tell where this process is breaking down. And that's one of the things that neuropsychologists are good at, is going over with a fine-tooth comb and figuring like where have things gone awry for somebody, and where might we be able to help. So again, I'm going to focus primarily on attention and memory today, as these are kind of some of the initial filters where people can have a real bottleneck. If you're not paying attention to something, you cannot remember it. If you can't remember it, you can't make informed decisions about how to prioritize it or how to organize information, because it just hasn't stuck or you're not able to access it in some way. Let's start with talking about attention. So what is attention? Um, some definitions include the act or state of applying something to mind, or the process whereby somebody concentrates on some features in the environment to the relative exclusion of others. So I'll come back a number of times to this metaphor as attention as kind of like a flashlight or a spotlight. We cannot pay attention to everything in the environment equally. It's completely impossible. When we use our attention, we are putting that focus on one thing in particular. And how we control that attention, or if we're controlling that attention at all, sometimes we're not really. We're just kind of on autopilot or wherever our phone has taken us, I think is a common one. That really impacts our ability to do all of those other thinking skills I was talking about. So why does attention matter? Attention is essential to be able to realize that there's information coming in. If we don't pay attention to something, we might not even know that it's there. Plenty of us have the experience of we're, going somewhere and we might be on autopilot, kind of daydreaming, and then all of a sudden we've moved a couple blocks, whether we're walking or driving, and wait, I don't even remember what happened the past couple blocks. Right? If we don't perceive the information, we're not tuned into it, we can't process it. And then we need to be able to process that information. So we can't remember it, we can't react to it, and we can't stick it out when something's challenging if we're not paying attention to it. There are lots of different categories of attention. These are some of them here. So focus, sustained, selective, alternating, divided. If anyone's feeling brave and wants to guess what any of these mean, I would love it, but I won't put anybody on the spot. Any takers? All right. So focused attention is really you're just paying attention to one thing at a time. Sustained is you're paying attention to something, but it's for a long period of time. You're holding it there. Selective attention is you're paying attention to something and maybe there's some distractions. So you're filtering out the radio playing, your kids in the other room making a lot of noise. You're intentionally putting your attention on something, but excluding other things. Alternating attention is more about moving between some different things. And then divided attention, which in truth we can't actually do effectively, is you're paying attention to two things at once. I also think of these like a staircase. So they're kind of hierarchically stacked in that some of these are much more difficult than others, like that divided attention I was talking about. And at this top of the staircase are the things that are hardest. You make the most mistakes. They're the most upsetting. Um, in general, we always want to try to work at the lowest level of attention we can. We are the most efficient when we're doing one thing at a time and it's quiet. So some examples here, reading in a quiet room, that would be sustaining your attention. Reading while ignoring the TV, that would be a selective attention. Reading and talking to a friend back and forth, that's the alternating attention. And then reading and cooking simultaneously, that's divided attention. That's really hard. I don't know if other people have had this experience, but I've certainly had times where I'm trying to cook dinner. I have young kids. They come in, they're talking to me. Maybe I hear my phone go off that somebody's texted me something. And the more my attention gets split, and then maybe I realize, oh, the timer's going off and now something smells a little bit burned, I'm getting more and more agitated. I'm feeling more stressed. And I also realize that I'm being less efficient. I might be less kind in my response to my kids, or I might make a mistake in what I'm cooking, or I might forget to respond to my friend because they sent me a message at a time when I'm too overtaxed. So the more we can do things one at a time, the more efficient we are and the less upset we feel. Okay, this is where I'm really going to test my technology abilities. I'm going to attempt to play a video. I think the sound probably won't work. That's okay. We don't need sound. I'm going to have you guys watch this, and then I will ask for some audience responses if people want to kind of mentally prepare that I will ask. You still can choose not to respond, but let's give it a try. Okay. All right, so it's got the answer here, but did anybody else get 16? Reggie? Yeah. Did anybody notice anything weird?
Someone saw 12.
Okay.
Someone said it was a little blurry, so it was a little hard to.
Okay.
There was a monkey walking among them, wasn't there? An ape?
Oh, all right. Dana, I'm going to keep going with this video. Oh, it's going to freeze on me.
Answer 16.
Well done, Dana.
Yeah. So I think this is just a fun example of how dramatically our attention can impact what we see and understand. I mean, the idea that this ridiculous gorilla can come across the screen and most people who are not attending to that or thinking about that or don't know that it's coming don't see it at all. And it's because we've told you the important thing to think about and to put your focus on, that spotlight of attention, is something else. And so how powerful that you can totally filter out something as absurd and kind of attention grabbing as this person in a gorilla suit.
I have seen this video before. So I did see the gorilla, but I knew that's because I knew it was coming, but I didn't see the other things that you asked us to pay
Yep.
attention to afterwards. So excellent. Really good
Yeah.
little mind.
Yeah. I mean, it's just a really it's an amazing demonstration of how much we can filter our attention. So there are lots of things that can impact our attention. Anybody willing, either in the chat or willing to unmute and suggest some things that might impact your attention? What kinds of things can impact how well we pay attention? Got the chat open. I see fatigue. Yep, absolutely. Hunger, phones, stress. Awesome. Yep. Noise. Yep. Background noise. Yep. Low vision or vision tracking, other people talking. These are great. Yeah, so you guys hit too dark or too bright in room lighting. Excellent. People walking by, pain. Awesome. You guys are giving some great ideas. Okay. So I think you guys hit on a lot of these, but there are lots of things that can impact our attention. Things like fatigue, how we're feeling, how our mood is, if we're feeling sick, our level of stress overall, medications. Some medications can directly affect our ability to pay attention. If we're having pain, if the room is too cold or too hot, or our body is uncomfortable in its position. It's great that somebody called out lighting. People often don't think of that. Is it too loud? Is it too soft? Is it too dark? Is it too light? Are we having some hearing or vision loss that might impact our ability to pay attention and get good information in? How alert are we? Are we sleepy? Have we maybe had a few too many glasses of wine? All of those things definitely impact our attention. And then our life experiences. So kind of a silly example, but the people who knew about this experiment, they knew to pay attention to the gorilla. And there's lots of other examples where we learn, this is important information to pay attention to. This is not, in either very obvious, somebody tells us that, or subtle ways. Our attention is shaped by what we've learned over time. So what are some things we can do to help our attention along? One of them is taking stock of what's distracting you. Is it something external in the environment? Is it more internal? Are you having a lot of worried thoughts? Are you feeling physically uncomfortable? Do you need to move to a room that allows you to focus better? Learn your attention span and also when you best focus. So can you give really focused attention? Is it 5 minutes, 10 minutes, 15? Learn your kind of optimal period and then work with that. You can really learn the way that your brain works best and adapt your work or study or chore habits to fit that. If there are thoughts that are distracting you, write them down so that you can deal with them later. If you're trying to really focus on a task like paying some bills and you keep thinking, oh, I need to do that. Oh, I need to do that. I'm very guilty of this myself. Oh, I need to go take care of that. I have a document right now, it's on my phone, but sometimes it's been a pad of paper where I just write it down. Okay. Last night I was going to sleep and I thought, I didn't respond to that email. I could have responded to that email as I was going to bed, but that would have woken me up. So instead I wrote it down, make sure tomorrow morning you take care of this email. That saves it. And I know that I'm going to go back and look for that. Using self-talk strategies to calm your self-focus. If I lose my concentration, I can do some relaxation, I can refocus again. What we say to ourselves really matters for attention. If you say, "Ah, I am the worst at paying attention, I don't even know why I try," versus if you say, people get distracted and I can try again, you're going to feel really different if you say those two things to yourself. So being kind to yourself, encouraging yourself will make a difference. Starting to notice signs that you're losing concentration, that you've zoned out. A lot of us can go on autopilot for a couple minutes even before we realize, whoops, I've been gone for a while. Um, and really, it's some of it is about setting yourself up to do that less, but some of it is just getting earlier and earlier in the process of noticing, oop, I've kind of zoned out. And maybe I need to take a break. Maybe I need a glass of water. Maybe I need to, take a quick walk to refresh my brain and refocus. But noticing that you've done that is the first step. And then having some explicit transition or adjustment rituals can really help. So having, if you're going to move into a focused task, like working on paying a bill or signing up for something that's boring, you have to go through a website. Um, Making sure that your workspace is clear, that you're in a good headspace, that you've taken a quick break beforehand. All of those things set you up for success to have more focused attention. Other strategies you can use are about creating more structure around what you need to do. Prioritizing, setting goals, putting actual tasks into your schedule. So sometimes we only have appointments in our schedule, but if I need to, you know, slides for a presentation, I might put that on my calendar that, I need 2 hours, or maybe it's, 4 half-hour blocks throughout my week to be able to get ready. That helps me not be doing things at the last minute and getting more stressed out. And then after you have a plan like that, to go back and check, did it work? They back in when I worked for the VA, they would call after action reports. You go back and, like, if we had a fire drill, how did it work? Did it work? Do we need to do anything different the next time? It's kind of that idea of, if I tried to do a task a certain way and plan it out, did it work out for me? Or is there something I might do different next time? And then come up, and we'll talk more about each of these, but strategies to help with sleep, mood, anything else that you notice inside is really getting in your way. Mindfulness is a big one that comes up when we talk about attention. I know many of you are probably familiar with mindfulness. It's been a big change in the last 20 to 30 years. Nobody used to talk about mindfulness. Now everybody talks about mindfulness. You can, I don't know, mindfully surf, mindfully grocery shop. Everything is mindful, but really at its core, even though mindfulness is very in vogue, mindfulness is all about paying attention. And it's all about paying attention on purpose. So I think of it plain and simple. You're controlling that flashlight. Instead of letting the flashlight go wherever your brain has decided to go, you are holding the flashlight and you are holding it on something on purpose. And the reality is that over time, our brain will drift. We will start to space out. We will think about something else. And mindfulness is about noticing that happened and pulling it back. Think of that as like the mindfulness bicep curl. So you're paying attention, you lose focus, you get distracted by your thoughts, and then you pull it back. And that's what really you're strengthening when you're doing mindfulness. It's that ability to take your brain from a distracted state back into a focused state over and over again. And it really is like a muscle. The more you practice that, whether it's focusing on breathing or walking or observing nature, and there's lots of, many people think of mindfulness as sitting and doing a seated meditation practice, but you can also be out in the world, or things like prayer or being in nature. All of those things are a very similar idea, that you're taking your attention and you're putting it on something intentionally. Um, and it's something that helps just strengthen that feeling of holding your attention somewhere on purpose. When we're thinking about external distractions, it's really about setting your environment up for success. Having a good place to work, wearing clothes that feel comfortable. Don't wear uncomfortable clothes when you're trying to do the most difficult tasks. Make sure you've got your glasses or your hearing aids or noise canceling headphones if you need them. Clear your workspace, and then make sure that you have timers set to give yourself some rest. Over time, our focus wanes for everybody. And if you just push through further, we get less efficient. And so having that recognition of, oh, okay, I've started to fall off, I'm gonna take a break and reset, is really helpful. And then also starting to have more organization systems, filing systems for how we track pieces of information. This is going to tie into memory, which I'm going to talk about in a minute, but starting to organize how you track pieces of information helps you pay attention to it. All right, let's talk about memory, kind of a complement to our attention. There's lots of different things that we try to remember throughout our life. There's things we have to do or places we have to be. There's what people say. There's what you read. There's things that are like a process. So riding a bike, doing laundry, taking a shower, the steps you do, thinking about things that happened in the past, stories from the past. And then there's things that they never really exist outside our own brain, things that we think or feel. And all of these our brain works with in different ways. Overall memory is like a filing cabinet. I think this is a really helpful way to kind of envision this, that the first thing we have to do is we have to pay attention to something and we have to see that it's there. If we're thinking about the filing cabinet, you have to realize there's a folder to put away, and then you have to look at it. What kind of thing is it? And the next part is figuring out where it's going to go. So encoding that information, getting it into your brain, putting it in the filing cabinet, closing the drawer, and letting time pass. That's storage or consolidation, holding on to that information over time. And then the last part is retrieval, which is you go into the filing cabinet and you have to find where you put it. You have to remember, a story my parents have shared with me is that they don't agree on how they file things. One of my parents thinks that you should file things alphabetically, and one of them thinks you should file them by category. And there's lots of things like this that, people think about, well, but then how am I going to know? Did I call this accounting or did I call this taxes? Is this under A or T? There's all these complicated things, but you have to work with your own brain and what makes sense to you. So where am I in the future going to look for this information? Or how can I make it so that I will remember that I put this under accounting? Because if you can't find it later on, even if it's there, it's going to be very hard to pull it back out. There's different types of memory. We have working memory, which is really just very temporary storage. I think all of us, probably our working memory has gone down in the days of smartphones. I remember, you had to look a number up and then you had to hold it in your mind while you ran to the phone and dialed it in. Or you'd call 411 and get the number, and then you had to dial it in. And now we can all, copy paste or do something easy or hit the link to just call. But things like that, things like remembering how much you have to pay on a bill while you go into a website or while you write a check. Those are all working memory, very temporary short storage. Or meeting somebody and them saying what their name is and trying to hold on to their name during a conversation. Short-term memory is shorter term, so that a little bit longer than working memory, but we're just in over minutes, hours, holding on to that information. And then long-term memory is the things that we hold on to for much longer periods of time. Things from the past, things that we're recalling from much longer ago. Does anybody want to guess what factors impact memory? You guys can start throwing stuff in the chat again. You had great answers for attention.
Feel free to type in there or come off mute. Someone's saying
Yeah.
sleep. I was going to say the same
Yeah,
thing. Yep.
sleep. Yep. Trauma.
Trauma.
Yeah, trauma.
Anxiety and stress.
Yeah.
Certain medications. And someone else mentioned earlier, and I think this plays in here, just chronic pain.
Yeah. Whether you've had enough to eat or drink, brain injury, excellent. These are all great answers. Yeah. Okay. And I think not surprisingly, you guys, oh, it's the same slide. It's all the same things. These all the things that impact our attention impact our memory too. All these things, both internal and external to us, can have the same impact on our memory the way they do on our attention. So how do we improve our memory? Kind of like those internal and external strategies with attention. There are things that directly impact memory, and then there are things that are more indirect and are about our surroundings or our overall well-being. One thing to know is that we really don't have any way to impact the storage of information. So once we've closed that filing cabinet door and we're just holding it in mind, we don't have great strategies to increase how well it's stored. That's much more of a biological process. But we can do a lot about how efficiently we get it in, how well we file it, and then how we figure out where did I file it and pull that back out. And then there's lots of things we can do related to all of that kind of rainbow of factors to improve our physical well-being, our emotional well-being, and our social health. So strategies to get information in and back out. The biggest one is reduce how much information there is. If there's a way to make more information into less information, that's always a good strategy. So, I'm in the 206 zip code where I work. If I think of that, every phone number is 206. That's a lot more information than I think 206. I can collapse that into a unit that I can remember more easily. Prioritizing things, so remembering the most important things and writing down what you don't need to hold in your mind. It can create kind of this mental clutter when we have a lot of things that we're just trying to hold in our mind, but have a place that you can write it down and have an organized place to write it down. I, like many of you, sometimes am guilty of the having the loose Post-its in my house. Discovered this week I lost a really important one. Had to go back and dig through a whole bunch of stuff to try to find it. If you can have, instead of a stack of I'm going to get to this later, an organized place, central home on a phone, on a tablet, on a computer, or on a pad of paper that all that stuff lives, it's so much easier to go back and reference that. It's also helpful to, when you're trying to remember something, to focus on how it's personally meaningful to you, to make some connection. Oh, and somebody said, oh, is that somebody uses GoodNotes. Great. I haven't heard of that one. I'll have to look into that. And reducing the distractions. So you're paying better attention, you're going to get better encoding. 5-subject binder. Love it. Okay. Other ways to support brain health and memory. Make sure you heard it. Make sure you understand. It's okay to ask for repetition or clarification. It's, I think sometimes people, especially if they feel like they didn't hear or process what somebody's saying, they feel a little bit shy or embarrassed about asking it to be repeated. In the long run, it's much better to just say, could you just say that one more time? That kind of blew by me. Than trying to kind of hang on in the conversation and pretend you know what's going on, and then you're missing more and more things because you don't exactly know what they were saying. Deepen your processing of the information by connecting it to other ideas. So making up a story about what you're trying to remember. One I always use with names is if somebody tells me their first name and there's a famous person that I know who has that first name, I try to think, okay, I just met Janet. Okay, maybe Janet Jackson. I picture Janet Jackson, and that helps me kind of make that connection, and then I make that association back when I meet that person again. Trying to visualize it, have a mental image. And then another big one is making it a habit. So if you can take information from I'm explicitly trying to remember it to actually it's just part of a routine or habit that I'm doing, that really reduces your load, your memory load. So giving things in your important items in your house a home that they live in. So a bowl for keys by the door. I have a magnetic key ring that stays by the door. The minute I walk into my house, my hand reaches out, I put it there. And it's become such a habit that I feel weird now if I don't do that. If I, make it into the kitchen, I'm still holding my keys, I think, this doesn't feel right. And it's because I've trained my brain to that's where they go. Another one is having some type of mnemonic or acronym that you use to remember. So WKP, if I'm walking out the door, I need my wallet, my keys, and my phone. So I get to the front door and I think, okay, WKP, did I do it? You can also make up songs for yourself. You can make up rhymes for yourself. We've made up things with my kids about water jacket and backpack to head, shoulders, knees, and toes. Do you have your water jacket and backpack? And we'd sing it to check, do you have all the things you need? And the more you can make it catchy for your brain, you can think, it'll help you realize, what are the pieces that are missing in the steps that I need to be doing right now. Another one I didn't throw on here is I'm a huge fan of air tags and tiles. They're on just about everything important that I own. Those are basically things that you can ping with your phone, that you can attach to keys. You can put tiles, the one that makes a credit card that you can put in your wallet. So you can actually make it make noise if you're somebody who loses your wallet around your home. Those things can really save people a lot of time if you are somebody who tends to put stuff down and then it goes missing for a number of minutes and it feels stressful. Um, other things that really matter for just keeping your brain healthy. One of them that we know is physical activity. There's good evidence that aerobic exercise in particular, so anything where you're breathing a little bit more heavily, in general, they say where you could still talk but not sing is kind of the sweet spot in how much heavily you want to be breathing, that they improve your both physical health, but also your mental health. I think everybody knows their doctor tells them they should exercise more, to keep your heart healthy, but we really say that heart health is brain health. Your brain is very sensitive to how much oxygen it's getting. And so the more you can pump more oxygen into your brain, it reduces stress in your brain and just keeps it functioning, happy, healthy. There's lots of options for exercise, including for folks who maybe don't have somewhat limited mobility. There's some great programs for people who are older, including things like silver sneakers, or this time of year when it's gross out in the Pacific Northwest, people who get together and walk the floors of shopping malls together or walk indoor tracks together. There's things that don't have a lot of high impact. And in the age of YouTube, there is virtually unlimited access to all kinds of different exercise programs. Sleep is another big one. When you think about kind of the pyramid of things that humans need to function well, I really think of sleep as right at the base. If you are not sleeping well, all of the other stuff, your nutrition, your pain, your thinking, your family relationships, it all starts to crumble because we really need good sleep. Sleep is also the period where things get kind of the gunk, to use very technical term, gets cleared out of your brain overnight, and your immune system works over time, and you also consolidate information. You take things from short-term memory to the long-term storage. And so that's why things like managing, if you have any type of sleep condition like a restless leg syndrome or sleep apnea, those are really important for brain health because they disrupt those normal sleep cycles where you're getting that restorative function. You're recovering from all of the stress of the day, but you're also disrupting when that information is getting moved into your long-term storage. Also has a big impact on our mood, as pretty much anybody who's ever had a bad night's sleep can tell you. We are more grumpy, more stressed, less efficient when we've had a pretty crummy night's sleep. Some sleep tips. Big one is a routine. So for anybody who's raised children, there's a reason kids have bedtime routines. We teach them, you do A and then B and then C and then you go to sleep, and A, then B, and then C, and then you go to sleep. And over time, by the time they get to B, they're really tired. And it's because we've trained their body that this is the sequence that leads up to sleeping. It works for adults too. So having a pretty consistent thing you do leading up to bedtime, sequence of what you're doing, maybe you read for a little bit or you drink a cup of tea as you're getting ready for bed. Those things are really helpful. Um, Light cues. Our sleep and our circadian rhythm, that's the rhythm of our sleep and wake cycle, is really impacted by light, and it's hard in the dark winter months here in the Pacific Northwest. So turning on bright lights, some people use those seasonal affective disorder lights, those really, really bright ones. If you're going to do that, you're going to do that first thing in the morning and tell your brain, like, now it's morning, and then have dark curtains at night. We don't need them now, but in the summer months, making sure that we're closing out some of the light. Exercising regularly, particularly outside, can help keep that rhythm, but you don't want to do it right before bed because that's something that can kind of wake you up. And then having something that you do that's a little bit more relaxing before bed. One thing I'll just kind of mention, because this is something that I didn't actually learn about till quite a few years into doing psychology, is about electronics and sleep. So some of you may have heard about blue light, which I'd heard about that, but I didn't actually understand exactly what it was about blue light that makes that's bad or makes us not sleep. And what it is actually pretty interesting. So where blue light is very intense is actually at dawn, so the very beginning of our day. And so biologically, our brains are cued to, when there is a lot of blue light, it's dawn. It's time to get going. It's time to, hit the ground running. And so if we're, using a device and we're shooting blue light right into our face, right as we're trying to go to bed, that actually confuses our brain and says, like, hey, it's actually time to wake up now. And so there's lots of things you can do. One is just use a plain old regular book. Many smartphones, I think somebody mentioned this, dark mode. There's lots of like filters that make your phone look a little bit more yellow that you can use. Yeah, and Dana, I see your hand raised.
Yes. Is there a difference between electronics and watching TV? Because when I watch TV, it puts me to sleep sometimes.
Yeah, I think so. The amount of blue light that you're getting if the TV is, say, across the room, my understanding is that it's less. Though TVs, at least the ones I know of, don't have a filter to turn down that light spectrum. Maybe they will make them at some point. But I would just say the further your TV can be from you, or if you could just do radio instead, would be even better. But that can help you sleep. What's particularly challenging about smartphones is usually people have them maybe 4 inches from their face. And so then it's really like a lot of blue light very, very close to your face.
So
And it looks like somebody
TVs,
is saying that there's something that you can download to tint your computer screen. Yeah, and I know definitely iPhones, I think most Mac devices, including iPads, have something called night shift, where you can, it's just a setting, maybe I think it's an accessibility that you can just set a schedule. So maybe from 7 p.m. to 7 a.m. every night, your phone looks a little more yellow. Substances can also disrupt sleep, not surprising to many people. I'm just keeping up with the chat. Okay. So alcohol, some people say alcohol helps me fall asleep. It may help you fall asleep. It does not help you stay asleep, unfortunately. So pretty much when alcohol clears your system, it actually wakes you up. And it causes people to sleep less deeply and get less REM sleep, which is some of that really important information transfer sleep. People who use nicotine products can also have lighter sleep and less REM sleep. It's primarily due to the nicotine withdrawal that they go into, because most people smoke pretty frequently throughout the day. So then going 8 hours or 7 hours without nicotine sends their body into kind of a temporary withdrawal period. And some people are more sensitive than others to caffeine at bedtime. And so some people find that, maybe as early as like 2 p.m., they actually need to stop drinking caffeine products. Oh, Grace, it looks like somebody put in the chat some information about that filter. Thank you.
And just an example of what it does. Very cool.
Yeah.
Thanks everybody for being so, engaged. Someone else says sleep mask and they put cell phone on sleep mode. Yep. Really just unplugging.
Yeah, exactly. That's went too far. Not surprisingly, managing your stress is a piece of this. We don't sleep well, we don't focus well if we are feeling really overwhelmed and stressed. We can't focus on new information. We might have a whole internal dialogue about what we're worried about or upset about or feeling bad about ourselves. And all of that really effectively pulls your attention away from what you want to be focusing on. So getting support if that's something you're struggling with. And there's lots of things either through more wellness practices or with a licensed mental health professional that people can do to learn breathing skills, visualization, mindfulness, strategies to care for themselves, things like cognitive behavioral therapy, to have tools to combat some of that negative self-talk or, kind of thought spirals. It's also really important to use your brain. So sometimes I'll work with folks who have recently transitioned into retirement and they're noticing that they're really struggling to use their brain in the way that they did before. And one of the things is that if you're not engaging your brain and keeping it active, you will start to notice more difficulties. Sometimes the phrase I use is, if you don't use it, you lose it. You have, same like any other muscle in your body, if you're not using your arms on a regular basis to lift things, those muscles will get weaker. And so it's really important to keep your brain active. That said, we oftentimes get questions about, okay, the big one a couple of years ago was lumosity. I think there's some new ones now. Do I need one of these fancy, expensive brain training programs where I'm going to sit on a computer every day and, play this game? Currently, what the research says is that those games generally make you better at playing those games. They don't generalize to the rest of your life in the way that I think people have kind of promised or had hoped, they might actually. It's more these little strategies. That said, if that's something you enjoy and that's what you want to do instead of maybe a Sudoku or a crossword puzzle, that's great. And you're willing to spend the money to do that, or you find a free one. All of that, it's not going to hurt you. And it's definitely better than sitting and passively watching TV for a long period of time. But it's really about finding different ways to use your brain. So something that you actually like, that feels challenging and interesting to you, and also learning something new. We know that continuing to learn new things is one of the really big keys to people whose brains stay healthy as they get older. So you don't just keep doing the same thing, you try new things, and you have that growth mindset. One more, we know that staying connected to other people really matters and is a really important way to keep your brain healthy. So there's strong evidence that when you stay connected to other people, your thinking skills stay sharper longer. When people get really isolated, it's a lot more challenging. And, if we think about things you can do to keep your brain active, engaging in a conversation is a way to keep your brain active. When you're talking to somebody, you have to listen, you have to understand what they're saying, you have to pay attention for a while, you have to respond appropriately. If they change topics, you have to change topics. There's this back and forth that's actually very stimulating for your brain. And so spending time with people you actually want to spend time with, who make you feel good, who help reduce your stress, that's one of the most important things that people can do. And that's often free. So I think that's always my big pitch for go spend time with people that make you feel good. People often ask when they talk to a neuropsychologist like me, when should I be concerned if I notice something in myself, my loved one? What's a red flag? And so I like to include this information because I think it is important. So if you're thinking about yourself or somebody you love, and the big things are there's big changes in what someone is doing day to day or how independent they are. There's changes related to things that really involve safety. So if someone were driving and they're no longer safely driving anymore, or they've gotten lost, or they're leaving the stove on suddenly, or their doors are open when that wasn't something they did before, getting really disoriented in familiar places, not zoning out and driving past your exit, or forgetting where you're supposed to get off, but really becoming for more than a second disoriented in your surroundings. Sometimes people starting to isolate from others can be a sign that somebody's having really bigger challenges. That could also be a sign of depression, though, and sometimes those things can go hand in hand or can look like each other. And so what I say is just always, if you have concerns about your thinking skills, your loved one, the starting place is almost always primary care. Primary care doctors, fortunately, are pretty well trained now in knowing, what would the next steps be? Should we be checking your blood work to make sure you don't have some type of vitamin deficiency? Or is there a medication you're taking that might be impacting this? Or, given everything we know, do we want you to see a specialist? And that's where something like my clinic can come into play of getting a comprehensive assessment to get a benchmark of where are these different thinking skills at. Okay, so some final take-home points before we hit the hour. There are lots of different parts to memory and attention. There are lots of things that can interfere with memory and attention. There's that whole rainbow of things that can go wrong. But also I think that means that there, the flip side of that is there's lots of things that if you make small changes day to day, you're likely to have your attention and memory get better. Because if you use a different strategy, or you work on improving your sleep, or you spend more time with friends, or you work on some new skills to manage your stress, or you try a new physical activity exercise, all of those things can have a really positive impact on you long term. So I'm happy to take any last questions, but that's all I've got. It's been wonderful to talk with you guys, and thank you so much for all your great chat participation.
Excellent, excellent presentation. Let me turn off the recording, and people are welcome to chat, share, just continue what's been happening in the chat. It's lovely. So bear with me for just a minute.
Reggie, I think I'm going to pull down my slides so we can all see each
Yeah,
other.
go
Is that
for
okay?
it. Sure, sure. Yes.